Today we'll be continuing our study of Titus 2, 4, and 5's instruction that we love our children, this time with regard to arming ourselves against needless and harmful interventions from the medical system during our labors and deliveries. Hello, and welcome to Wisdom for Women, where we study the Word of God and the words of God, applying them practically to our daily lives, our habits, our decisions, our personalities, our work, our play, and our relationships. This is a gender-specific channel for women. 1 Timothy 2:12 says, "But I suffer not a woman to teach, nor to usurp authority over the man, but to be in silence." At the same time, I'm commanded, as an aged woman, to teach the young women. In light of that, let me make it clear that if you are a man viewing this episode, you should know that my teaching is not directed toward you. Today and every day, I'll be reading from the centuries-old Authorized King James Bible, the perfectly preserved English translation of the very words of God, and we will together study to show ourselves approved, workwomen who need not be ashamed, as we rightly divide the word of truth. Let's get right into our scripture. Titus 2, 4, and 5, that they may teach the young women to be sober, to love their husbands, to love their children, to be discreet, chaste, keepers at home, good, obedient to their own husbands, that the word of God be not blasphemed. We're on the topic of loving our children, and in today's episode, we're going to look specifically at some of the landmines you may and likely will encounter if you labor and birth your baby within the modern medical system. I encouraged you in my last episode to give birth at home if at all possible, and I want to reiterate that today. But in case you are stuck with a hospital birth, I would like to walk you through what that experience might entail and how you can mitigate as many needless and harmful interventions as possible. This is a longer video, so feel free to use the timestamps to take it in sections. Let me insert a disclaimer here and say that I am not a medical doctor, and none of this should be misconstrued as medical advice. I am not giving medical advice to anyone. In fact, I am giving the exact opposite of medical advice. I am giving anti-medical advice, and I admit that openly and freely. Take it for what it is. I encourage all mothers, whether planning a hospital birth or a home birth, to read up on your rights. Last episode, I mentioned the Patient Self-Determination Act, a federal law which allows you to decline any procedure and to leave when you want, even against medical advice. There are also online courses you can take in order to really know your way around the medical profession. I will recommend Birth Monopoly's Know Your Rights course, and I'll link that in the description below. Back to the hospital. One of your first jobs upon entering the building will be to sign a consent form. It is vital that you, the mother, read this form carefully and cross out any procedure that you do not personally authorize. And honestly, most of the procedures are invasive, potentially dangerous, and can trigger a cascade of events that end in cesarean section, which of course is the most expensive and therefore desirable to the medical system birth alternative. Let's look at one of these consent forms together so you will see what sort of plans the medical establishment has for your birth. And remember what Dr. Robert S. Mendelsohn stated about the medical field: anything that can be done will be done. So as we read about these procedures, know that if you do not specifically cross them out and stand your ground, these procedures and interventions will be pushed on you. And if you arrive at the hospital unprepared and distracted, which you likely will be if you are in labor, you might not take the time to read the form carefully, or your husband may be handed the form while you are ushered into a birthing room, and you may inadvertently sign up for a birth you never wanted, a birth that may leave you and your baby traumatized, and that will cost thousands of dollars more than a simple delivery. So let's look through a sample consent form together so you'll know what's waiting for you. This consent form I just took off the internet. It was like every other consent form, and it's from the Baptist Hospital of Miami. It's an informed consent for vaginal delivery or cesarean section. I would just cross out the cesarean section right from the start. It says, "I hereby request and authorize Dr. Blank and or such physician associates as may be selected by my physician to perform on me the following procedures, the natures of which have been explained to me by the physician in plain language that I completely understand: spontaneous or assisted forceps and or vacuum vaginal delivery with or without episiotomy, incision at vaginal opening, or cesarean section if necessary, and additional procedures." Okay, here's a great opportunity for you to cross out assisted forceps and or vacuum and cross out with episiotomy and cross out cesarean section. If you are in decent health, then you should not, in my opinion, consent to any of those right off the bat. And know that later on, if such a thing should be necessary, you can always say, yes, now I consent. Moving on. My physician has informed me in plain language that I completely understand of any medically acceptable alternative treatments. I understand that I have the right to refuse a procedure or to choose one of the alternatives. Okay, this is a very important sentence to remember, and I personally have had to use this exact wording to a doctor. I will tell you that story later on in this episode. Next we read, I have been made aware of and acknowledge that the practice of medicine and surgery is not an exact science, and that no guarantees or assurances have been made to me as to any of the results and risks. I also understand that there are general risks in performing any surgical or invasive procedure, including but not limited to possible injury to surrounding structures, including tissue, blood vessels, nerves, and adjacent organs, severe loss of blood, infection, allergic reactions, heart, brain, liver, or lung complications, kidney failure, loss of limb, cardiac arrest, or death. All right, that first part, yes, surgery is not an exact science, but we're not coming here for surgery. So I would cross out all of the surgical stuff. Just cross it out. You're not coming here for surgery. You're coming here for a natural vaginal delivery. Next, my physician has explained the risks and benefits of the above procedures in plain language that I completely understand. My physician has also discussed expectations about my recovery after the procedures. I understand these risks may be greater if I am a smoker, overweight, diabetic, have high blood pressure, or a history of heart disease. I understand the specific risks of the above procedures include, but are not limited to. Okay, so cross all that out. Now we have risks specific to vaginal delivery. We have tears of vagina, vulva, or rectum, possibly resulting in urinary and/or fecal incontinence. Okay, I don't think that's going to happen. That's a very far-fetched thought, so we can just leave it. Then labor abnormalities, such as slowed labor or fetal intolerance to labor, which may require a cesarean section or other resuscitative measures. Cross that out. You're not going there for a cesarean section. Including internal monitoring. Absolutely cross that out. Do you want them to screw an internal monitor into your baby's scalp? Shoulder dystocia. The baby's shoulders can be lodged under the pubic bone, requiring various maneuvers to dislodge, rarely surgery. It can result in nerve damage, brain damage, or death to the baby. It cannot be effectively predicted and can occur without warning. Now let me just say, shoulder dystocia can happen. I had shoulder dystocia with one of my children. And what you might want to try is if the shoulders are stuck, give a few coughs. Many times this will move the baby right on out. Okay, next we have sudden separation of the placenta from the uterus, abruption, which may require emergency cesarean section, and nerve injury due to positioning, maneuvers during delivery, or separation of the pubic bone. These are very unlikely consequences of birth and delivery, but I wouldn't even bother about them. Now we have risks specific to cesarean section. I would cross this entire area out, but let's read through it together anyway. Damage to internal organs, structures including bowel, requiring further surgery, including the possibility of colostomy, which is when they make a little hole in your abdomen and then you have to wear a bag. Bladder and other urinary structures needing repair, prolonged bladder catheterization, and rarely further surgery to correct. Nerves. Feeling numb around the surgical site is common. However, nerve damage that may cause temporary or permanent numbness or weakness of the limbs may occur. Fetal laceration, a cut on the baby's skin, which is usually not severe, rarely requiring treatment. Formation of scar tissue inside the abdomen, making future surgery more risky. Poor wound healing and pain of incision, the need for repeated cesarean sections in the future as determined by your doctor. Okay, all that's crossed out. Now, risks of both vaginal delivery and cesarean section. Infection, during labor or after delivery, which may require medication or rarely surgery. This shouldn't happen if you are declining all pelvic exams. Excessive blood loss or hemorrhage requiring medicine, transfusion, or surgery including dilation and curettage, or hysterectomy, removal of uterus to treat severe cases. It shouldn't come to that. Preeclampsia or eclampsia, a condition of pregnancy characterized by development of high blood pressure other signs, and rarely seizures, often requiring medicines to control. If you are normal and healthy and there's been no sign of this before, then preeclampsia or eclampsia should not just start when you get to the hospital. So I wouldn't worry about that. Injury or death of the baby. This can happen anywhere, anytime. That's the way the world works. So I would not worry about this. It's very far-fetched. Fetal brain damage or death can occur prior to labor due to genetic, metabolic, or other disorders beyond our control. Rarely, brain damage or death can occur from lack of oxygen to the brain during labor or delivery. That will happen if you get put on Pitocin. More likely, it won't happen normally in a regular birth. Changes in fetal scalp and head and minor bruising are common in labor and are usually without consequences, occurring more often with assisted forceps vacuum delivery. Cross that out immediately. Rarely, injuries to the scalp and head are more serious. Development of blood clots in legs, deep venous thrombosis, or lungs, pulmonary embolism, requiring blood thinners, uterine rupture rarely occurs, and may require emergency surgery. This will happen way more likely if you get put on Pitocin or Cytotec, and doesn't normally ever happen in a regular birth. Maternal brain damage or death from pulmonary embolism, amniotic fluid embolism, shock, or other unforeseen cause. These will happen much more likely with Pitocin or Cytotec, and then other specific risks. Now, on page 2 of the form, you are informed of the benefits and risks of vaginal versus cesarean delivery, but you can just cross out all the cesarean delivery parts if you want. You're not in the hospital for a surgery. You are there experiencing a normal biological process. You are not ill. You do not have a disease. You are a woman created to bring life into the world, and your body and your baby have decided that this is the time for that normal biological process. Next, it says, I consent to the administration of medications by or at the direction of the professional performing the above-mentioned procedures for the purpose of reducing pain, discomfort, and/or emotional stress that I may experience. I have been informed of and understand the risks, benefits, and alternatives of these. I would cross that whole thing out. Do you want to be medicated during your birth? I wouldn't. Then, if any unforeseen condition should arise during the course of these procedures, that's them giving you medicine, I do hereby authorize and request whatever steps and whatever procedure is or are deemed advisable, which may be in addition to or different from those that are planned. Forget it. You're not going to let them medicate you anyway, so this doesn't matter. Okay, next. I consent to the appropriate disposal of any tissues and other body materials that may be removed during the course of the procedures. Let's stop here and mention what disposal of any tissues and other body materials really means. Placentas are routinely used in a wide range of medical and cosmetic research, and even in the training of search and rescue dogs. According to an article in the Standard, which I'll link in the description below, quote, for the company's scientists, the placenta is a rich raw material, as it contains especially high levels of proteins and enzymes. They're able to extract these and turn them into a total of 7 chemical compounds, which it offers for sale to laboratories around the world. Among them are alkaline phosphatase and collagen, a substance widely used to stimulate skin growth and in some cosmetics to combat wrinkles. It is also used in shampoos and conditioners to strengthen hair. Placentas will also be used for research into cancer, cystic fibrosis, Parkinson's disease, and HIV/AIDS. Not only does the hospital have the right to profit off your placenta, your tissues, if you consent, they are also interested in the blood from your baby's umbilical cord. According to Janice Barcelo's Birth, Trauma, and the Dark Side of Modern Medicine, their habit of clamping and cutting the umbilical cord immediately after birth, despite the fact that it is dangerous and harmful to the child, should also concern us greatly. This medical butchery cuts the baby off from its oxygen supply and deprives the child of vital stem cells and nutrients necessary for the proper development of the immune system. It can also lead to a number of serious problems, including autism, cerebral palsy, anemia, hypovolemia, hypotension, ischemia, shock lung, respiratory distress, oliguria, hypoglycemia, ischemic encephalopathy, mental retardation, neural, behavioral, and developmental disorders, and more. In truth, this procedure is not being done because it has any benefits, but rather so that the infant's cord, blood, and placenta can be harvested and sold to the highest bidder. This includes the cord blood of vulnerable premature infants. The cord blood of preterm infants contains more stem cells than normal infants, and interestingly, early cord clamping is particularly promoted for these infants by the medical establishment due to its higher market value. The welfare of the child is not even considered. For the hospital, this blood is a premium sales item because it contains more nutrients and stem cells. These are desperately needed by the weaker infants. This need is ignored, and the cord blood is literally stolen from the sickly child and then sold for maximum profit. There is no doubt that this cord blood would result in much healthier premature newborns. Okay, there's also the concern with the tissue removal that we, the mothers, should have about our child's DNA data being collected by the medical system when the tissues and other body materials are kept by the hospital. I highly recommend you Xing this out and asking for your own placenta in advance and refusing to allow the hospital to clamp and cut your child's umbilical cord. You are allowed to refuse this unnecessary and often harmful and invasive procedure. Know that the hospital staff will likely be angry at you about this, but you must remain calm and immovable by their hysterics. Okay, back to the consent form now that you know what that means. Next on the list, we find I consent to the observation of my procedure by other healthcare providers for educational purposes. I further consent to the admittance of qualified observers and/or technical advisors to the operating room as determined by my physician and Baptist Hospital. Further, it says, I further consent to my physician or designee permission to make a photograph, videotape, or similar record of the procedures, which shall remain in my physician's custody for the purposes that my physician has explained and I have agreed to. This is a no-brainer. Do you really want students coming in and peering at your private areas? Do you want photographs, videotapes, or similar records of your most personal, intimate biological act as you labor and bear your child? I would absolutely outright refuse such an invasion of my privacy. Okay, the doctor has to sign this consent form as well as you, and he should be able to see that you are not consenting to any of those procedures or interventions. But you might need to reiterate your wishes as your labor goes on, because doctors are notoriously used to getting their own way, even if they are denied it in writing. My own experience in the birth of my second child involved some of this refusal to consent. It was 1997, and the state where I lived had outlawed midwifery completely. Midwives were being jailed for practicing medicine without a license. The climate for home birth was pretty dicey. I had delivered my first child 2 years earlier in 1995. My first baby was delivered frank breech and posterior by me at home with the assistance of an illegal undercover midwife, because the doctors would not allow me to have a vaginal delivery with such a presentation. For those of you who aren't familiar with these terms, it means that my firstborn came out of me behind first and sunny side up, meaning her face was toward the front of me. Several doctors had pressed me to schedule a C-section for the birth of my child, but I didn't want that, and I didn't see any reason that my healthy body couldn't deliver a child who was breech. So I left the medical system several weeks before my due date, and I never went back to them. Delivering our breech and sunny side up firstborn successfully at home gave me a great deal of confidence in my own reproductive capacity. It was with this outlook that I began laboring with my secondborn 2 years later. As I approached transition in that birth, the direct entry midwife who was helping me suddenly couldn't find our child's heartbeat. She was alarmed and told us to rush to the hospital. Not realizing at that time that I have a deep pelvis and losing the baby's heart tones during transition is a commonplace event for me, we rushed out the door and sped to the hospital. Once we got there, a nurse checked for the heartbeat, and sure enough, there it was, just like it should be. At that point, I had a choice on my hands. I could walk back out of the hospital and go home, or I could stay for the delivery. I probably should have chanced the drive home in retrospect, but I felt like the birth was imminent and I should just stay put. Well, the doctor on call heard from a nurse that I had been planning a home birth, and he immediately regarded me as a threat. He entered the room where I was and said arrogantly, "Now, I know you thought you were going to have a home birth, but all that's changed and I'm in charge now. If I feel like you need Pitocin or an episiotomy or an epidural or a C-section, then that's what's going to happen. Do you understand me?" He was threatening and ill-mannered and apparently used to doing what he wanted on the OB ward. Thankfully, I was between contractions, so I could still breathe and talk, and I told him calmly but forcefully, no, you won't be doing any of those to me. I have the right to refuse any and all interventions by this hospital and by you. Honestly, I'm not sure how I had the presence of mind to say that to him in the moment, but my husband assures me that I did, and he backed me up 100%. The doctor was visibly angry with me and stalked out of the room. Meanwhile, a nurse decided I needed an external fetal monitor, which was uncomfortable. I told her I wouldn't wear it, period. She backed down and allowed me to forego that elastic torture device. Thankfully, the doctor left me alone for the last moments of my labor, until my second born was shooting out of me like a rocket, and then the doctor quickly left the room as soon as the birth was over. When the hospital bill came, my husband and I laughed about what an easy $900 that doctor made. Of course, I know that he was angry that he couldn't make $10,000 instead, since that was the going rate for C-sections at the time. Anyway, once I had my newborn son in my arms, I decided to head home. My husband and I gathered my things together, and we prepared to walk out of the hospital. Suddenly, everything shut down. The ward was in an uproar. Nurses nervously told us, no, you can't leave. Doctor hasn't seen the baby. Doctor hasn't seen you. We haven't released you yet. I said calmly, my baby's absolutely fine, as you can plainly see, and I'm perfectly fine as well. I'm ready to leave, and I'm going home now. Looking back, I think that must have been the first time a woman had asserted her rights on that ward, because it upset the entire establishment. My husband and I began leaving, and a nurse ran up to me with a form for me to sign, letting them know that I knew that I was going home against medical advice. I signed it quickly, and I left. And that was that, until the next Sunday when an emergency room nurse in our congregation came up to me and said, boy, you sure threw the hospital for a loop earlier this week. All the buzz was about some woman who walked in the OB ward, gave birth, got up, and walked out against medical advice. She said, I asked them if it was you, and sure enough it was. I've thought about this situation many times since that day 29 years ago. I've helped other women during their hospital births and have tried to stand up for their rights and advocate for them. And every time it's been as though the women had no idea they could actually tell anyone in the hospital no. I've seen women coerced into wearing the elastic fetal monitors, blood pressure cuffs, IV ports, even saline IVs that they have to drag around the ward with them as they walk during their labors. Women have had nurses who tell them that they have to let their babies be examined by the pediatrician in the nursery without the mom coming along. When I questioned one nurse about this, she replied, we have to do it that way for privacy and security reasons. I said in disbelief, privacy and security? That baby has been inside his mom's body for the last 9 months. This mom has every privacy and security clearance that anyone could need. Okay, let's take just a moment and glance at some of the other interventions and protocols the hospital has waiting for you when you arrive there to deliver your child. Number one, it goes without saying that staff will expect you to wear an unattractive hospital gown. There are now some alternative sites out there on the internet, such as Lila, which I'll link in the description below, that offer birthing gowns that are much prettier and still supposedly hospital compliant. You might try one of these. You will certainly be asked offensive and unhelpful questions like, do you feel safe at home? Because, as we mentioned in our last episode, the medical profession is quite suspicious of your husband and seems to want to undermine your relationship with him. Number three, you'll also be repeatedly asked, how would you rate your pain? I find this to be a completely offensive and demoralizing question, the equivalent of asking a marathon runner 3/4 of the way through the race, on a scale of 1 to 10, how tired are your legs? It's discouraging, distracting, and unhelpful during a time when you need all your powers of concentration and strength to accomplish this enormous job, during a time when you actually need encouragement and support from those around you, not unhelpful distractions that break your focus on the end goal and force that focus onto your present discomfort. Number four, you'll be given a pelvic exam to check your cervix for dilation. If the doctor or nurse wants to strip your membranes or break your waters while he is up inside you, he'll probably go right ahead, unless you have told him beforehand that you do not consent to this. Just so you know, you can also refuse consent to this pelvic exam, so keep that in mind. Number five, it goes without saying that you'll not be allowed to eat anything. The hospital might allow you to chew on ice chips, but if your labor is long, you'll just have to be hungry. Remember, ladies, this is the biggest job you'll ever do. And yet the hospital will not allow you to strengthen yourself with nourishment because guess what? They are planning for a C-section, in which case they need you to have an empty stomach. Number 6, there is a fair chance that you may be given the drug Cytotec to stimulate your contractions and dilate your cervix, especially if your labor slows down a bit once you get to the hospital, which is a common effect of disrupting labor. Cytotec is not approved by the FDA for use in pregnancy, and it has been proven to be dangerous to women and their babies, yet it can still be administered, even without the mother realizing it. Now I'm reading from Janice Barcelo's Birth Trauma and the Dark Side of Modern Medicine. After Cytotec is inserted into the vagina, it dissolves instantly. There is no turning back. There is nothing that can be given to reduce the severe tetanic, very violent and painful contractions wearing on the mother's uterus and depriving the baby of oxygen far longer than can be tolerated. Why do healthcare professionals continue to use Cytotec, knowing of the potentially devastating effects? Because Cytotec is inexpensive. The cost is 25 cents per pill. The cost in terms of human life and the resulting permanent damage that Cytotec can do cannot be measured. As long as this non-evidence-based practice continues, babies may suffer permanent brain damage. Mothers might never have children again because the tetanic contractions caused their uterus to rupture, requiring a hysterectomy to save their lives. Mothers who suffer amniotic fluid embolism may live through it, but with near-death experiences. Number 7, another drug that may be pushed upon you if your labor seems slow to the hospital staff is Pitocin. Both Pitocin and Cytotec are interventionist medications that begin a cascade of complications, including most notably the need for epidural anesthesia. Reading again from Barcelo's Birth Trauma and the Dark Side of Modern Medicine. Pitocin is another drug that is used against label every day in the United States for the induction and augmentation of labor. Like Cytotec, Pitocin has not been approved by the FDA, and on the contrary, the FDA, along with the World Health Organization and even the Physician's Desk Reference, warn against the use of Pitocin for the elective induction of labor. The use of Pitocin to induce or augment labor can lead to a number of serious complications, including uterine rupture, uterine hyperstimulation, postpartum hemorrhage, fetal distress, fetal asphyxia, fetal heart abnormalities, low APGAR scores, permanent central nervous system damage, brain damage, and death. Despite the long list of serious complications caused by this drug, a 1992 University of Texas survey reveals that 81% of women in U.S. hospitals received Pitocin to induce or augment labor. That was back in 1992. Pitocin inductions are a leading cause of C-sections and are one of the main reasons the U.S. has one of the highest C-section rates in the world. Pitocin-induced contractions lack a slow buildup and are much stronger, harder, faster, and more frequent than normal. When uterine contractions are too hard and or too long, uterine blood flow is reduced, and the baby is deprived of oxygen. It's important to remember that the baby experiences every contraction just as the mother does. Unnaturally strong and long contractions produced by Pitocin are quite difficult for the baby, not just painful for the mother. While a mother opts for pain medication to numb her experience of the monster contractions, the baby does not experience pain relief. When the baby experiences the increased pain and decreases of optimal oxygen supply from these unnatural contractions, his heart rate is compromised, which prompts the diagnosis of fetal distress and leads to the conclusion that a C-section is necessary to save the baby. Of course, the OB is merely saving the baby from the unnecessary and dangerous complications that were caused by the administration of the induction drugs. Pitocin is artificial synthetic oxytocin. Its use during labor tricks the mother's brain and interferes with her ability to produce natural oxytocin. If natural oxytocin is not pumping through mom's body during childbirth, her ability to bond with, breastfeed, and experience love for her baby is severely undermined. Not surprisingly, Pitocin use during labor disrupts bonding and breastfeeding and damages the newborn's oxytocin receptor sites for life. Nearly all women who are started on Pitocin end up feeling that they need an epidural because the contractions are so unnaturally intense. But what the doctor and anesthesiologist will not tell you is that the epidural actually hurts the baby. Barcelo explains it thus. Like Pitocin, epidural anesthesia also tricks the mother's brain. In a natural birth, the mother will produce natural opiates and beta endorphins to counteract any experience of pain and induce feelings of pleasure and well-being in mother and baby. However, when epidural anesthesia is introduced, these natural opiates and beta endorphins will cease to be produced and will not be circulating through the mother's body. What this ultimately means is, although the mother will not be feeling any physical pain, her baby will be feeling more pain, since her baby needs those natural opiates and beta endorphins in order to deal with the intensity of labor. But unfortunately, those important hormonal ingredients will not be present, and the baby will suffer as a result. Consider the words of this brilliant video entitled Epidural Release Form, which is a parody of the so-called informed consent form. I wonder how many women would sign this if they truly realized what they were doing by submitting to an epidural. It goes like this. I understand that the pain from labor causes my brain to release endorphins. These are natural painkillers, which can be likened to morphine or heroin. These opiates are so powerful that they can cause women to have an out-of-this-world or high feelings between contractions, and they also have been known to cause euphoria during and after birth. When I receive an epidural, I understand that my baby will feel the pain of labor more intensely because my body will stop producing and circulating the hormones mentioned above. I choose that my own pain be removed and that my baby feels the pain of labor more intensely. Number 9, if your baby doesn't come out as quickly as the doctor thinks it should, he will feel free to use either suction extraction or forceps extraction to pull the child from your womb. I personally know of 2 different cases where this has had a lifelong adverse effect upon the baby. One of the children was brain damaged for life, and the other has a severe lazy eye caused by the pressure of the forceps on his skull during birth. Number 10, also if the doctor thinks he needs to hurry your birth along, he may opt to do an episiotomy, in which he slices the side of your perineum so that the baby will fall out more easily. He may also do this if you show signs of tearing naturally. What he won't tell you is that a natural tear only happens where the skin is stretched out the most thinly, and therefore it heals easily and without numbness, whereas his episiotomy will be through thicker tissue and will require stitches afterwards, which will cause scar tissue and possible numbness and lack of elasticity. Number 11, if you panic at any time during your labor, which can be slightly common during the throes of transition, you may be coerced into wearing an oxygen mask, and the doctor may even administer nitrous oxide through your mask as well to calm you down. Number 12, we've already discussed the fetal monitor, the IV, the immediate cord clamping, and the trip to the nursery for the baby without you. Number 13, then the hospital will demand that your baby's heel be pricked for a PKU test. This involves the nurse poking into your child's tiny heel and then squeezing and squeezing the heel until he has enough blood for the test card. Not a nice thing to do for your brand new little one. Number 14, speaking of your baby's feet, the staff will want to take ink footprints of your baby, whether you want that done or not. Number 15, they'll also want to bathe your child and weigh your child and will not allow you, the mother, to do this. Number 16, the staff will want to swaddle your baby, whether or not you want this done. Number 17, they may press you to let your baby also be in a warming tray, though the warmest place is right next to your skin. Or they may put your child in an incubator. Number 18, the doctor may also push for vaccination and or circumcision if you have a boy before you leave the hospital. Number 19, staff will administer a shot of vitamin K in your baby's thigh, supposedly to help his blood clot, although the same effect would have happened if they had simply allowed you to eat a banana during labor. Number 20, and the doctor will put either silver nitrate drops or erythromycin ointment into your baby's eyes, just on the off chance that you have gonorrhea, even if you've told him that you don't have gonorrhea. Remember from last time, doctors never believe you. It's important to realize that these drops and ointment cause your new little one to have very cloudy vision, just at a time when you wanted to connect and bond with him or her. And number 21, understandably, all these unnecessary inventions cause a new mother way more stress than she would have had at home. And between the stress, the artificial hormones and drugs, the lack of food, and the overall unnatural birth process, the new mom and baby could very well have difficulty establishing a good breastfeeding relationship. When this normal biological process of breastfeeding is interrupted or halted, there are yet more side effects, from gut dysbiosis in the child to a lifelong propensity toward obesity in the child to an increase in postpartum depression. Again, reading from Janice Barcelo's Birth Trauma and the Dark Side of Modern Medicine, consider the following information from a very important article entitled Breasts in Mourning: How Bottle Feeding Mimics Child Loss in Mothers' Brains. The article suggests that bottle feeding an infant rather than suckling an infant at the breast will evoke feelings of grief in the mother, as her body and brain will interpret the lack of a baby at the breast to mean that her baby has died. Quote, so what happens when, for whatever reason, mothers do not breastfeed their healthy infants? According to a new theory being proposed by the University of Albany evolutionary psychologist Gordon Gallup and his colleagues, the decision to bottle feed is tantamount in the mother's psyche to mourning the loss of the child. At least that's how a woman's body seems to respond to the absence of a suckling infant at its breasts in the wake of a successful childbirth. In a soon-to-be published article in Medical Hypotheses, the authors argue that bottle feeding simulates the unsettling condition of an infant's death. Opting not to breastfeed precludes and/or brings all of the processes involved in lactation to a halt. The absence or early cessation of breastfeeding would have been occasioned by miscarriage, loss, or death of a child. We contend, therefore, that at the level of her basic biology, a mother's decision to bottle feed unknowingly simulates child loss. After that list, I hope you can understand why I have been urging you so strongly, my sisters and daughters in the Lord, to opt for a home birth, where none of these interventions can complicate and disturb your labor, which, as we've said before, is a normal biological process, one that God has specifically designed your body to do successfully. I recommend that you read Sarah Schmid's Freebirth, which I will link in the description below, and perhaps watch a few of her birth videos to get an idea of how natural and low-key a labor and delivery can be in the comfort of one's own home. Be aware that these videos are graphic depictions of birth, so watch them without your husband and children around. Sarah goes through all the stages of labor gently, quietly, and comfortably, and catches her own babies in her hands as they emerge from her body. Having done this with my own children, I can tell you there is no greater pleasure on earth. Sarah also calmly deals with any natural anomalies of the birth process, such as the cord being around the neck, which is very common, and mucus that needs cleared from the baby's airways, which Sarah simply does by sucking with her own mouth and then spitting the mucus on a pad beside her. There is no panic or emergency. There is simply a mother owning her birth, confident in her natural ability to perform this entire biological process. Again, if you are pregnant, I completely recommend watching some of her births as personal inspiration. It is certainly not the screaming, medicated nonsense we've been fed by Hollywood movies and shows. I'll link one of her videos in the description below. Birthing your child at home is a joy and delight. I was blessed to have 5 of my 7 children in my own comfortable home, with my husband attending. Those 5 were welcomed into the world while my husband prayed and read scripture aloud, usually Psalm 91 and Psalm 121, which were favorites of mine for births. I was able to take walks, relax, and eat during my labors. I was not encouraged to push before my body wanted to push, so my pushing time was minimal and without extra pain. In 2 of my home births, I even enjoyed the natural pain relief of birthing in a tub, which felt great. After each birth, I was able to relax and enjoy my child without doctors and nurses pestering me and checking vitals or anything like that. My husband and I could snuggle up together in bed and watch and get to know our tiny newborn child, which is well nigh impossible in a hospital bed. I could keep the lights dim and could play music I enjoyed while I was laboring. Afterward, we chose to cut the cord when we deemed the time was right, and we handled the placenta according to our own wishes instead of the dictates of the medical system. The breastfeeding relationship was calm, unhurried, and beautiful. I hope for each of you, my sisters and daughters, that you can have such an experience of this normal biological process, and that you will be saved the unnecessary and harmful interventions and complications that the medical system of this world would like to force on you and your baby. Join me next time as we talk about breastfeeding, diapering, and other care of your tiny newborn.